And now it's my great pleasure to introduce a treasured colleague and friend, Mark Pauly.
Thanks, Mary. First, I want to welcome everybody back and welcome the new grantees and other new visitors. I was one of 6 children, and my dad was one of 7 children growing up in Cincinnati. So one of the highlights of the summer always was the family reunion when you got together with all your cousins and had fun and got to see how everybody was doing. As time passed, my aunts and uncles have died off, and people have moved away from Cincinnati. My dad, who just celebrated his 98th birthday the day before yesterday, still doesn't understand why anybody would want to move away from Cincinnati. I mean, you have everything you need for a happy life there, but some of us did. So we don't have that big family reunion anymore, so INQRI is kind of my surrogate. Glad to see everybody back. I was asked to talk about putting the I in INQRI, and I guess I first need to say the obligatory thing. I meaning you or me means you ought to take a personal stake in the INQRI program. I probably don't need to say that. But also I want to talk about the interdisciplinary aspect of this program, which Mary and Lori and I and the people who encouraged us at RWJ have taken very seriously from the beginning. And so I have just 2 things I want to make a few remarks on. Why you are here and why some other people are not, and then what you should do given that you're here. So the most obvious thing to say is almost everybody gives lip service to the idea of interdisciplinary research at Penn. Our president, Amy Gutman, has been very enthusiastic about it. We have a program called PIC. Penn integrates knowledge to hire faculty who will do interdisciplinary research, and that's all warm and well and good. But I think what we were apprehensive about, and still are to some extent, or at least on guard against, is interdisciplinary focus is just kind of a warm glow. That it's a good thing. We'll have some people from other disciplines in, but they'll be mostly window dressing, not substantive. And those of you who are here who were successful were successful in part because you went beyond the warm glow or the window dressing approach to interdisciplinary research and actually integrated another discipline into your team. The team matters, and as well as the CVs that are attached to the application process. Part of that was because the overall objective of INQRI is to provide credible evidence that nurses can contribute to quality. And by quality, we mean quality, not nursing quality, but real quality or quality defined by anyone. And the view was that the credibility of this research would be enhanced by having participation from people outside of nursing, thought leaders outside of nursing, imaginative scholars outside of nursing, and I'm happy to say that that has definitely been achieved. The sort of successes and failures, at least when this has happened to me, when I've gotten successfully gotten a grant in a competition, the people who lost always want to know, what did you do, to try to figure out what they should have done. So here's what you did that they should have done, and if you want to spread the word back at the ranch, because we'd love to fund a whole lot of projects of imaginative ideas, but we are quite careful to make sure they do have the I present in them. This is what people need to pay attention to. The interdisciplinary contribution, I think, in the largest number of grants has been in terms of contributing methods and models for analysis. One of the hallmarks of INQRI is we want interventions to be able to demonstrate causal effects, not just correlation. And there are contributions from other disciplines that can help you do that. There should be a conceptual model behind a project. Likewise, there can be contributions from other disciplines to help for that. A number of proposals, not all, but a number of good ones, have proposed to analyze some rich bodies of large sample data Generally, that means you need someone with expertise in statistics or econometrics or qualitative modeling, or whatever it might be, in order to be able to do that. So that's important. And then finally, we're still kind of beating the drum for this. So this is a message to spread back at the ranch. We'd like, as you may have seen in some of the past call for proposals, we'd like proposals that said something definitive and defensible about how nurses contribute to value. And so first I have to be the ugly economist and say one measure of value is the business case, the monetary measure of value. It's not the only measure of value, though. Improved health outcomes for given resources are also a measure of value. And we think an interdisciplinary team can contribute to that as well. The second model, which has also been successful, has been to engage a health professional who is an important contributor to an interdisciplinary approach to providing care, for example, a pharmacist or a physical therapist. What you shouldn't do, nobody here did it, but what other people tried to do, you can't just make your interdisciplinary collaborator be the chair of the Department of Medicine and kind of wheel him or her out on state occasions and imagine that that's going to constitute interdisciplinary research. So for those of you who are here, you have successfully made that combination that I just described, and I just want to reinforce it, say that we read very carefully to make sure you weren't flim-flamming the program a bit, and whether there was actual genuine contribution and genuine commitment here, and congratulations to you. The other part of my remarks is now going forward, what should you do? Well, the most obvious thing is to work together in reality as you promised in your proposal. There's always a bit of apprehension in any proposal. You promise what you hope you'll be able to do, and sometimes not always what you will be able to do. And it's certainly been true in the completed proposals. People have worked together in reality as well as collaborated in the proposal development.